Starting today, there are new restrictions for visitors at hospitals in the area to help stop the spread of illness. The CDC says the week before Christmas, 34,000 people in the U.S. were hospitalized with COVID, the flu, or RSV. WRAL's Laura Levine joins us live from Wake Med in Raleigh right now. And Laura, these new restrictions are to help protect the most vulnerable people, right?
Jeff, good morning. That is correct. And doctors tell us things are going to actually get worse before they get better. You may have noticed if you've had to stop at one of these hospitals that masking has already been required at many of them. And now, starting today at hospitals like Wake Med here behind me, they're going to make sure that they are able to protect the most vulnerable population. We're talking about young people from flu, COVID, and RSV with these new restrictions. So beginning today, this morning, visitors in all Wake Med hospital patient care areas, including waiting rooms, must be at least 12 years old. Similar restrictions go into place for UNC Hospitals Chapel Hill, Hillsborough, and youth behavioral health campuses. Visitors 11 and younger are prohibited from all inpatient areas and all waiting rooms there. Now, this comes as more patients in North Carolina hospitals are being treated for flu and COVID-19 for the first time since the start of the pandemic. We spoke with Dr. David Weber with UNC Hospitals about the latest step to stop the spread among young people.
Not necessarily easy to tell when a young child is ill because they can't verbalize things such as feeling poorly, fever, and others. So that is one reason. Two, children, of course, they also have higher viral loads so that they are more contagious than older individuals.
Now, tomorrow, Duke Hospitals is also limiting visitors to 2 at a time per patient, and children under 12 are not allowed to visit. Dr. Weber also says that the flu peaks mid-January and February, so right now there is no sign indicating that this is slowing down anytime soon. It is important to mention that there are some exceptions to these restrictions, such as if you have a patient who may be dying. Laura Levine, WRAL News, live in Raleigh.